Centrally acting muscle relaxants like Lioresal or Baclofen. Baclofen's, again, that generic name, and Lioresal is that brand name. These act on the central nervous system, okay? The way they act on the central nervous system is that they enhance the inhibitory effects of the GABA on receptors in the spinal cord. Bottom line, it suppresses hyperactive reflexes and muscle spasticity by working on the central nervous system. I would call this also a type of central nervous system depressant, okay, because it brings down some things in the nervous system. Therapeutic used for muscle spasms. Many people with MS, CP, cerebral palsy, spinal cord injuries, and localized spasm due to injury benefit from this medication. A lot of people with MS will actually have this medication given in a pump form. And so that's quite interesting. And, you know, those people, if the pump ever becomes malfunctional, or if it becomes empty or just turns off, these people have been usually on it for quite some time, and they are really at risk for some of the withdrawal symptoms. We'll talk about that just in a second. So adverse effects, I want to really focus on these adverse effects. Remember, drowsiness, dizziness, weakness, fatigue, these go away after using it for a while, but remember, this is working to relax the central nervous system, relax muscles via the central nervous system. So remember, people shouldn't be driving if they're dizzy and drowsy. So when they're on this medication, they are not recommended to drive. We need to be good at telling people this. Even bartenders need to tell people about not driving, right, with alcohol on board. So, you know, as nurses, that is the least we can do, right? Reduce dizziness, rise slowly if you're dizzy, and lay back down or sit down if you become dizzy while you're standing up. That'll decrease your risk of falling. Nausea, vomiting, and constipation. NVC. I tell you what, these are such common adverse effects. You are relaxing muscles, so of course you're going to be a little constipated, right? I mean, what moves your food through the GI tract? Well, peristalsis, right? Can you do that without muscles? No. So constipation is one of the side effects. Nausea and vomiting can happen. So we tell people to take it with milk or food, like we tell people to do with a lot of different medications if they have nausea and vomiting. Because of the constipation, we want them to have plenty of movement, fiber, and fluid. So they may need to take a mild laxative or a bulk builder. So just keep that in the back of your mind. Urinary retention is rare, but we do tell patients about this because if it does happen, they should let their provider know. There might be a much better medication for them. And so I'm always happy when they decide to go with something else if the person is experiencing urinary retention. But that's the provider's decision. So we can give with food and milk to reduce that nausea, vomiting, or any gastric upset that might occur with that. The provider will start with the lowest dose and increase gradually. We want to work with the provider. It says here doctor, but on a NCLEX you're going to hear the word provider. So work with the doctor to discontinue the drug. We don't want to just be abruptly stopping this drug. We need to taper it to avoid withdrawal, including seizure, hallucinations, rhabdomyolysis, which is basically a breakdown of muscle tissue that occurs sometimes from seizures, made kind of worse by the fever that might go with it. And then what can happen with the proteins that end up breaking down during rhabdomyolysis is they can clog up the kidney and cause damage. I did see a Baclofen withdrawal once with a patient right after I got out of nursing school, guys. This happened immediately when I got out of nursing school. I was actually watching a patient for a colleague of mine that went to lunch, and I was in the ICU, and I knew very little about this patient, but I did know that the patient was on Baclofen. The pump malfunctioned, and we didn't know that the pump malfunctioned, but I did see that the patient was experiencing, he did have a seizure, he did have a fever. We immediately called back my colleague from dinner and got the providers there. These were intensivists, so they're right in the hospital. We did figure out, oh gosh, that's gotta be the pump. I cannot believe I pulled that out of my brain. Everybody's like, how did you know that? I'm like, I just got out of school. So at any rate, don't take these with MAOIs. It's kind of a weird reaction with MAOIs. It causes CNS depression and hypotension. Also, don't take this with SSRIs, SNRIs, or tricyclics. These are some antidepressants you're going to learn about next week, because the mixture of these can exacerbate or cause serotonin syndrome. And we'll talk about that next week. Exciting stuff, right? Have some considerable caution in the elderly, children, and those with seizure disorders and cerebrovascular accidents for a number of reasons. Either the elderly, it might accumulate a little bit more. The mental illness, it might interact with some of their other meds they're taking, and or it might interact with some of the biochemical processes that cause their mental illness. So we got to be real careful with that. Okay, and then we already talked about this, but it's worth another repeating. Work with the doctor to discontinue the drug. We need to taper it. We can't just abruptly stop it. Signs of withdrawal include seizure, hallucinations, rhabdomyolysis, kidney damage, and fever.